frozen shoulder is a layman's term for the medical terminology, which is adhesive capsulitis. The capsule of the shoulder is like a sleeve around in the ball and the socket, and that has to be flexible for the arm to be able to move normally. When that sleeve gets inflamed and tight, then the range of motion of the shoulder is diminished, and it's a painful condition.
There's essentially three phases to a frozen shoulder. There's first the freezing phase, where the patient progressively loses motion and it's usually quite painful. And then you move into the frozen phase, where the patient now has a stiff shoulder but usually isn't very painful. And then into the third phase, which is the thawing phase, as the patient begins to get motion back. Now, this whole process, if you just let it ride out its natural course, can last anywhere from 6 months up to 2 years.
The way we treat that is by and large with physical therapy. It can be a long course, many months of trying to get the shoulder to move well again, to loosen up that capsular tissue, but that does work for most people. Oftentimes we'll try cortisone injections as well, which can help lessen pain during that process. But for people who have either a really long course or really struggle to make headway with the therapy, we will consider surgery sometimes. That can be a manipulation of the shoulder, where we just forcibly move that shoulder through range of motion in the operating room under anesthesia, or sometimes surgery to actually surgically release that tight tissue.